Hello, this is Dr. Gay from First Look MRI, and this is a 15-year-old male who did some excessive exercising about 4 days ago and has had pain and swelling in the front of the arm and really worried about a biceps tendon rupture. So we did this to evaluate the biceps tendon. And on this view here, it's called an axial view, we have fat suppressed, so the marrow is dark. And this is one where there's no fat suppression, the marrow is bright. And we can see on this view with the arrow that he has a bone injury. This is the medial epicondyle, the medial part of the humerus. We see that there's abnormal brightness. The bone should be dark, the marrow like this. And on this view, we have an arrow pointing to the same area. And this is a growth plate here. And this is the ossification center, the medial epicondylar ossification center, a growth plate. And all around here, there is edema. We don't see on this image, it's blurred by motion. And the fat is not suppressed, so we really don't see edema on this. But on this one, all this area that's bright, this is edema. So stress reaction, injury around that growth plate. Luckily, there's no displacement of the growth plate. That ossification center is there. It's right in here. It's not displaced. So this will go on to heal, hopefully, with conservative therapy, but just stress reaction, and that's contributing to the pain. But there's one other finding that looks like is just as serious. And this is in the front. We have the biceps muscle belly up front here. We have the triceps muscle back here. And the biceps and triceps muscles are nice and normal dark. But in the middle, sandwiched between them, we have another muscle called the brachialis and another one here called the brachioradialis. And these muscles are edematous, especially the brachialis. We see the central tendon of the brachialis right here coming down. This is the central tendon, and this is the abnormal muscle that's bright around it. And we can see the central tendon attaching to the ulna. Right there is where it attaches. And we see the biceps there attaching to the radius. So these two anterior tendons are intact, but the brachialis muscle belly is diffusely edematous, and so is the brachioradialis. So this is what we call delayed onset of muscle soreness, DOMS. And patients who do excessive exercise, really strain their muscle with overuse, can get muscle soreness. The muscle becomes edematous and sometimes swollen. They can get edema, sometimes in the skin like this. And usually this is self-limited. Rarely, these patients can go on to get a compartment syndrome where the muscle will swell up and become edematous, intense, and they can even constrict its own blood supply. That's very rare. And also, you can get what's called rhabdomyolysis, or rhabdo, and that's when the muscle tissue breaks down and it releases some of the muscle proteins into the bloodstream, and they can even get dark urine associated with that, and it can cause very significant, maybe even life-threatening problems, sometimes with renal failure and other things. And so that's something we worry about. So the patient apparently did not have any tea-colored urine that would make them think that, but they're going to be evaluated closely to make sure this gets better. Apparently it has gotten better over the last day or so. But this is something that looks like it's probably delayed onset of muscle soreness from excessive exercise and stress injury of the medial epicondylar ossification center over here. And that's it. Thank you very much.